Welcome, folks. Welcome to the recording of our Foundations of Massage class related to our missing week. Today, it is the week of going into the week of the 29th, which is the Thursday class that we'll be missing. This class is to compensate for that missed class. So let's go in, and we're going to start with our lecture today right off the bat, so as we don't waste time. We are going to focus on questions related to. It's going to come up on your screen in just a moment. Cautions and contraindications, safety in the workplace, and regulations for massage therapy. One of the homework assignments you are completing for this class would be the exploration of the New York State Office of the Professions website related to massage therapy. We're going to be skipping some activities here, but ultimately there is a homework assignment based upon one of them where you'll go and you'll find the correct answers related to the following questions. Are we legally required to wear a name badge? Can you claim to use a secret or special method of massage? Can you prescribe or diagnose as a massage therapist? Is a massage therapist who is not properly dressed considered immoral? Or who is exempt from needing a massage therapist license to do hands-on work? Much of this information can be found in that area, in the Office of the Professions website. Should you not find it, I highly recommend reaching out to me or various sources online to find that information. Now, what do we mean when we say moral? What are we looking for a massage therapist? The record online indicates that we need our massage therapist to be of good moral character in order to be licensed. And that follows with this particular questionnaire that you'll see when you're applying for your license. Questions, because the printing is quite small, questions that you'll see. Since your last registration application, have you been found guilty after trial or pled guilty, no contest, to a crime, felony, or misdemeanor in any court? They're checking to make sure that you aren't potentially dangerous to yourself or other people. Since your last registration application, has any licensing or disciplinary authority revoked, annulled, canceled, accepted, surrender of, suspended, or refused to issue a renew or license because you've been censured or reprimanded? Bit of a paraphrase there. Has there been anything that's happened to your license over the past couple of years? Important for them to know. If something has happened and you lie about it, you'll never get a license. If you have gone to court and you lie about it, you'll never get a license. Sometimes if these things have happened, you can still get your license, but it might involve some extra communication. Since your last registration and application, are criminal charges pending in any court? You need to answer honestly to that. Are charges pending against you in any jurisdiction for any sort of professional misconduct? We definitely need to know that. Since your last application, has any hospital or licensed facility restricted or terminate your professional training, employment, or privileges? Or have you voluntarily or involuntarily resigned or withdrawn from such an association to avoid the imposition of such action due to professional misconduct, unprofessional conduct, incompetency, or negligence? Again, we are looking to maintain a professional behavior as massage therapists. We all have a basic understanding of what that is, perhaps, but we're certainly going to talk about it in future weeks once we delve into topics such as ethics, topics such as professional demeanor. We're going to make sure that we know how to behave appropriately as massage therapists. There's another segment here related to child support, asking if you're under obligation to pay child support. That's an important question because if you are and you haven't been paying it, there will be a record of that. And that can speak to your good moral character. The last one on here is the Personal Responsibility and Work Opportunity Act. This one indicates that you're either a US citizen or that you have other dispensation that allows you to work in the United States. This should be filled out when you apply for your license, and all of us need to fill it out. Very good. To look for information of such things, such as precautions related to our professions, we have our Office of the Professions Massage Therapist Precautions webpage. I'm going to stop the slides for just a moment to get us over to that webpage so that we can take a look and see what that indicates. Here we are. Precautions for massage bodywork and therapy. There are times when we should not be touching a client. There are times when we should be cautious, and these elements are as listed. Massage therapists should not treat a patient or client when they are in an altered state of cognitive awareness from the use of prescription or over-the-counter medications or recreational drugs such as alcohol, or the patient cannot give informed consent. If the patient cannot give informed consent, we cannot perform massage upon them. If a patient refused to give therapist consent to confer with his or her healthcare practitioner regarding massage bodywork therapy, such as a consultation is essential to the patient's client's health and safety. If they say, no, you can't talk to my doctor about my health, that's a big red flag, and we should not treat our clients. Massage therapists should use caution in treating a client that has a fever or contagious disease. Frankly, fever and contagious disease are no longer merely a caution, but certainly a contraindication with rare exceptions. One of the few exceptions would be AIDS or acquired immune deficiency syndrome or HIV, where it's not actually contagious to you, the therapist, because the processes by which you would contract AIDS do not occur in a standard massage. If a patient is on any medication that would expect to weaken bone structure or connective tissue, any kind of drugs that will compromise the structure of the client are considered contraindications. If the patient has edema due to chronic heart failure or kidney failure, that is very much a caution for circulatory work. If the patient or client has an inflammatory condition in the acute stage, any inflammation in the acute stage is a no-touch. If the client has acute phlebitis or deep venous thrombosis, that can also lead to a type of contraindication. Or if the client has acute trauma or recent surgery, generally we do not work on those. Even though they're listed as a caution, we generally do not work on folks with these conditions until they are considerably healed. Practitioners should observe these guidelines. While massage of splint muscles around a swollen joint is appropriate, direct pressure to the joint itself should be avoided. That is correct. We call that proximal, distal, proximal. The idea that you work above, below, and above such a structure. Avoid local site of unstable fractures, open wounds, hematomas, varicosities, recently healed scars, burns, and foreign bodies or implanted hardware. That is correct. We should not make contact with damaged tissue structures. In the first trimester of pregnancy, no deep sacral work or abdominal massage should be done. Generally, we don't do much abdominal work. It tends to be a fair rarity in our business, but we should also be aware of the issues with deep sacral work. If the client or patient has cancer or other tumors or has acute or chronic infection in the skin or deeper tissues, seek the recommendation of a patient-client's physician or nurse practitioner after obtaining consent of the patient or client. This is the doctor's note rule. If it's the type of disease that could lead to spreading or your touch could make worse, we seek the confirmation from a doctor. That is the doctor's note rule. If the patient is overheated due to hot tub, sauna, or exercise, apply appropriate techniques. If someone is overheated, generally it's like the body is all slightly acute. And once again, when the body is acute, we do not pursue massage. Very good. We're going to head back to our slides in just a moment here. With our slides, we're going to return to information related to being a massage therapist. And one of the chief statements we're going to find about being a massage therapist, I mentioned this in class the other day. Some of you wrote this down, and you will take this oath when you finish massage school. That is related to do no harm. The Hippocratic Oath centers around the idea that we as massage therapists should never be doing harm to anyone. The first and foremost rule for all healthcare practitioners to follow is do no harm. In order to avoid doing harm to our clients, we must be aware of the contraindications as well as general and local cautions, which affect the way that we perform massage treatment or refrain from it altogether. We cannot work on everyone who comes through our office. Not everyone is capable of or should be receiving massage. Not everybody should receive it. And so that's an important thing to keep in mind for your treatments. The dispositions listed here are related to massage availability, practice, and safety. When a massage should not be performed, massage is considered contraindicated. That means massage should not be performed. The opposite of that is indicated. If massage is indicated, it should be performed. But contraindication as you see here on the screen, says that it should not be performed. A general contraindication, or a full contraindication, as it's sometimes called, means that you will avoid massage altogether. You will not touch the body due to issues that may arise with their health or your health from touching them. An example of this would be someone who has poison ivy or a possible highly contagious disease like scabies. A local contraindication tells you to avoid massage to the specific area of the body that's affected. This might be because of a broken bone. This might be because of a burn on a part of the skin, leading to a local contraindication. The next one down here is a caution. A caution is when a massage can be performed, but with special alterations or modifications and/or. An example there is you might have a client that has heartburn or gastroesophageal reflux disorder. Folks with that condition can receive massage, but they shouldn't be lying flat, which can make their condition worse. That's an example of how that one can be a problem. A list of general contraindications as listed: severe distress. If someone is emotionally in distress, if they are in tears and cannot stop crying and are having terrible issues emotionally, physically, that is a contraindication. We don't indicate massage or force massage on people who cannot tolerate the work. Nausea and vomiting. This is usually, or at least sometimes implicit, of a contagion, or at least distress to the body, in which case we will not work on a client that is vomiting. Sounds pretty fair. Recently injured. Any new injuries presenting with the body are considered contraindications. They are considered acute and in the process of healing and should not be touched. Bleeding. We never put our hands in a position where we will contact blood. Blood, in addition to being indicative of a notable injury, is also possibly full of contagions and is dangerous for us to touch and for their blood to be touched. We note that it says fever here, or contagious disease. On the New York State website, it said that a fever would be a caution. Generally, a fever occurs because the body has had some kind of infection that can lead to bigger issues. In such circumstances, a fever would be contraindicated. Again, under the influence of drugs or alcohol, we mentioned that is compromised ability to communicate. We cannot work on that. And one that was recently added to this list answers yes to COVID screening questions. If there's a chance your client might have COVID, you should not be working on them. Therefore, that is a full contraindication. Do not massage folks with those conditions. On the list of local contraindications, these are again places where you're going to avoid direct pressure because you can lead to further injury. Varicose veins follow on this list. That's a vein, usually in the legs, sometimes elsewhere, where the walls of the venous structures have been dissipating and the valves have broken down, leading to blood flowing back on itself in the veins. Pressure there can be incredibly painful, and it is profoundly listed as a local contraindication. Any undiagnosed lumps or bumps, if they don't know what it is and you don't know what it is, don't touch it. The thing that you might be palpating might be a tumor. It might be a ganglion cyst or a sebaceous cyst, and working on it could make their condition worse. So that is a no. Bruising, cuts, and abrasions. Cuts and abrasions make sense because blood is present. Bruising is damage to the vascular tissue underneath the surface of the skin. Bruising does rate as a contraindication, as do cuts and abrasions. Sunburn. We should not be touching damaged skin ever. This includes if the skin is healing from a minor burn. That healing process might be compromising the structure of that skin. We can't even apply things such as burn cream or aloe to that tissue because our touch could make damage to that tissue worse. Sunburn is considered a local contraindication for us when we are working as massage therapists. If you're working on a loved one and you're not functioning as a paid massage therapist, do as you will. But in office, we do not work on that. Any pain that is undiagnosed, again, if we don't know what it is, we should not be working on it. And so that comes down to a local contraindication as well. If any such pain becomes suddenly acute, like vibrantly acute while we are working, correct protocol is to end the session and refer the client out to a doctor immediately. If the client goes from, oh, I'm just, I'm receiving a massage and everything's cool, to all of a sudden being in sheer agony, something has changed. Might have been something you did, unlikely. It might have been something structural. All the more reason that you refer them out as soon as possible. Severe inflammation. Anywhere where the skin is warm, inflamed, and red should be locally avoided for touch. Again, for similar reasons as what we have previously discussed. And the last thing on the list here is fungus. Fungus, being like any other topical issue, is incredibly contagious, much like poison ivy, much like ticks and fleas and lice. These are things that are systemic contraindications. Fungus, however, is something that can be locally contraindicated, as it might be just on the feet, like athlete's foot, or just in the groin area, like jock itch. That would be locally contraindicated unless the fungus covers 30% or more of the body, in which case we would consider the body a full contraindication. We also have some medical contraindications. These conditions may require medical release from the client's doctor or a doctor's note, and or special training for the massage therapist. Examples of that: pregnancy. There are courses of study in prenatal massage or pregnancy massage. I was trained in it when I was in school. I don't believe you will get it here at QCC. I do highly advise taking Kira Nagel's class on prenatal massage. She's the local expert in the entire New York area, and I strongly advise that and will refer you to her classes should you want it. Cancer. Cancer is definitely an MD-related massage, and if it is mid-treatment, does require some extra training. If you're interested in this, I would recommend speaking to the folks at Sloan Kettering, which is the main cancer hospital here in New York City, for further information and training. Cardiovascular conditions. Generally, someone with cardiovascular conditions has notable limitations to receiving touch. This can be dependent on any surgeries they've received or any medications they are on. Certainly, high blood pressure is a contraindication unless the client is chemically treated. They need to be on medication before we can work on it. You will discuss this in your pathology classes, as well as classes like Western 2 and Western 3. Nervous or psychotic conditions. Folks with profound neurological instability are in a position where they should be closely monitored or observed by a doctor, or at least braced with a doctor's note before they receive massage. Some folks with severe psychological issues might be having that work done in hospital, in which case you will be under the supervision of a doctor. It's incredibly rewarding work, but it does require further training. Last one on this list is epilepsy. Epilepsy is, if it is a frequent occurring seizure condition, then yes, you will need some observation. Most folks who are epileptic are well aware of it and are taking their anti-seizure medications and are generally fine. However, we do need to keep the idea that they are epileptic on our radar, and it does mean adapting treatment should anything occur. Very good. Your knowledge and training will help you determine contraindications from cautions. Look down this list and take guesses. If an area has loss of structural integrity, Do you think that that's going to be a local contraindication or a caution? Generally, that's going to be a local contraindication, but there might be instances when you could work on it. Skin conditions, a local contraindication or a caution? It depends on the skin condition. Some skin conditions are very much contagious. Others are not. If you don't know what the condition is you're looking at, it is highly advised that you avoid the condition. You're not a doctor, and you cannot diagnose what that condition might be. Decreased sensation, local contraindication, or caution. If the client has a compromised ability to feel your pressure, it is at least a caution. If the tissue is numb, if the individual cannot feel your touch, it is certainly a local contraindication. If it is a new concept for them, the massage should be stopped and they should be referred out rather than working on something they were not aware of. Increased sensitivity to touch. This one is definitely a caution. If touch can be excruciating with the lightest of touch from you, there might be something systemically wrong. That might also need a referral to an MD. Cardiovascular disorders. As stated before, this depends on what type of cardiovascular disorder, and a thorough conversation should be had between you and your client before treatment. Edema, local contraindication or caution. Edema is generally a local contraindication. The lightest of effleurage may be done over the top, but anytime there is fluid retained, there's the possibility of damage to tissue underneath the surface if you press too deeply. This should rank as a local contraindication. Compromised immunity, local contraindication or caution. As this is systemic, it rates as a caution unless the immune system is no longer functioning at all, in which case it is a contraindication, and the client is usually under the care of doctors and in a hospital. As compromised immunity is a risk for your client, you should always be able and ready to cancel or reschedule treatments if you yourself are sick. Your illness, even just a runny nose or a sniffle, can be life-threatening to someone with compromised immunity. Last on this list, osteoporosis, local contraindication or caution. In this circumstance, it is a caution to work on someone with osteoporosis. Your pressure will need to be lighter, as excess pressure could lead to damage to the bones in the structure. How do you feel you did on this exercise? I hope you did well. Let's press on to our next slide. There are a number of medications that we're going to require caution. Or possibly a phenobarbital or a Valium. These are definitely cautions in play. Anything that affects the blood and the circulation, such as insulin and blood thinners. Generally, these are cautions. However, strong blood thinners and anticoagulants are considered contraindications. These are medications such as Coumadin, warfarin, and Plavix. Are active contraindications and will be tested as such on the New York State boards. When we're in class in a couple of weeks, I will go over those names once again. Any medications that compromise the integrity of the tissues, such as corticosteroids, hydrocortisone, or cortisone shots, can negatively affect the strength of the tissue into which they are injected, even though they will alleviate pain. Steroids in general are a caution at the very least, depending. Anything that alters moods, such as depressants and antidepressants. Those medications that you may take, those SSRIs, can be considered a caution, as massage can change their metabolism rate. Depressants are things such as alcohol, which can certainly affect the mood of the client. Also on this list should go strong painkillers, specifically opiates. Anyone who is on an opiate is frankly in a position where they shouldn't be receiving massage lightly, and that massage should be delayed until the reason they're receiving opiates is no longer present. Again, that is with consultation with a doctor. Sometimes massage will be used, but you need to communicate with their doctor regarding that treatment. Massage therapists treat people. We don't just treat the condition. As we mentioned in class a couple weeks ago, we treat the whole of a person, which is why our work is considered holistic. Our treatment is to treat the whole client and focus on wellness. We're not in the business of treating specific injuries usually. Sometimes we'll treat someone with carpal tunnel syndrome, surely, or plantar fasciitis, and massage can help. But our goal is to create general benefit of well-being to the entire client. As such, we tailor our sessions to the needs, goals, and preferences of our clients. If our client doesn't like having their feet touched, we don't insist upon it. If our client doesn't want their ears massaged, we won't do it. We give the massage that the client is looking for. Very good. This brings us to our second main topic of the day, which is related to personal and professional safety and workplace safety. Many of you have worked at jobs where you've had to go through the sexual harassment training episode. This occurs even here as we're training to be massage therapists and we understand about workplace safety. We, as much as anyone, will face potential issues of workplace safety, as there is this standing stigma about massage therapists still, that somehow we are practical sex workers when we are not. This harkens back from a situation in the 19th century, the late 1880s, where people would pose as massage therapists and work in another field. And we have worked very hard for the past 100+ years to clarify the difference between the two jobs. Licensed practical sex work is legal in parts of this country. It is something different than massage therapy. The idea of workplace safety. Workplace violence, as we understand it, could be inflicted by an abusive employee, manager, supervisor, coworker, which some of us may have experienced, and I'm sorry if you have. Might be administered by a client or his or her family member. Sometimes clients are perpetrating behavior that is not acceptable to massage therapists. Sometimes it is a family member who's doing it. Sometimes it can be a complete stranger, someone who's wandered into the facility and is treating people with disrespect. Warning signs about harassment as we might experience it. Bullying or harassment, people who are using negative language, people who are oppressive with their being, with their bodies, with their tone, people who are asserting themselves in an overly dominant way to a massage therapist. That classifies under inappropriate and aggressive behavior. Any physical contact that is not welcomed is considered an aggressive behavior. In massage therapy, we often say, and feel free to write this down in your notes, we say that touch is a one-way conduit. I, as a massage therapist, am licensed to touch you. You should not be touching me. If a client is touching you or trying to force you to do work by moving your hand somewhere, that is harassment. Warning signs such as conflicts with clients. Warning signs such as conflicts with clients or coworkers. If people are perpetually giving you challenges and problems, this is worth reporting to your supervisors, or it is worth encouraging that individual to seek another therapist. If this persists, legal action may need to be taken, which we will discuss. Concealing weapons or threatening use of weapons, always a warning sign That's a high warning sign. Excessive desperation. People will sometimes come to massage therapists sad and in need of touch. But if people are overly desperate, there is the risk that they may harm themselves or someone else. That is a warning sign. Direct or veiled threats of harm, whether it be to themselves or someone else, that is a reportable offense, and it is considered a warning sign. Alongside this, substance abuse. People who frequently come for massage under the influence or who are working as massage therapists under the influence are considered warnings, as well as extreme changes in normal behaviors. People who are no longer major personality shifts are definitely a warning sign as well. If you observe these warning signs, notify managers about clients or coworkers. If it's someone you're working with or someone who comes into your facility, tell your manager. Put it on your manager's radar. If you are the manager, evaluate and investigate the nature of this. It might lead to conversations. It might lead to a confidential report. It might lead to contacting the authorities. It is at your discretion when you're the manager. If the manager is the perpetrator, notify the owner. If the manager and the owner aren't the same person, go above the manager's head and say, hello, owner person, this manager is treating me with disrespect. If the owner is the perpetrator, attempt group intervention or look for a position elsewhere. If it's the person who's in charge, they might be getting off on the power of being a massage therapist owner or someone who works with massage therapists. This might be a whole pattern for that individual. If you care enough, it might be worth intervening, or it might benefit you best to move on to another job. In general, the average amount of time that a massage therapist spends at a spa or gym job in New York City is roughly 6 months. Don't feel bad if you have to leave one job and head to another, because frankly, it's somewhat expected of this field. Should someone be inappropriate with you during a session, specifically of a sexual nature, it is always at your discretion to end the session at any time for any reason. Generally, we like to finish our sessions because that's how we get paid. But if someone is inappropriate with you, if someone is trying to touch you, if someone is making veiled comments and you don't feel comfortable in that room, get out. Say, the session is over, I'd like you to get dressed and leave, and get out of the room. If you're in a facility, go to the manager's office. Tell the manager what happened, have the manager escort them out. I've been the manager that's escorted these individuals out. I'm happy to do it. And we never let them back in again. If you are on a house call, leave the premises immediately. Leave your things behind. Grab your bag, your purse, if it's easily grabbable, but otherwise get out. Get out as fast as you can. Reach out to the authorities or reach out to other massage therapists. If you're doing these house calls through an organization like Zeal, reach out to Zeal, tell them what happened. Usually organizations or your local authorities will go back and help you get your things. If it's your table you need to pick up or your purse or your phone, the police will help you with that. Zeal will help you with that. I would help you with that. But never put yourself in a position where you're left alone with someone who's going to threaten your personal integrity or attack you. Get out as fast as you can. Once you've gotten out, we recommend recording or writing down exactly what happened. Write it down 3 times. Write exactly what happened down 3 times. You'll keep a copy of that. A copy might go to your manager. A copy might go to the police, or possibly you'll keep a copy on file. You need to document when these things happen to make sure that they don't try and twist the events of what happened or say, well, it didn't quite happen that way. It's your job to write down exactly what happened and why you left. Make sense? I'm happy to talk at greater length about this next time we meet, but definitely put this on your radar. High risks in the workplace. If you're working in facilities that have situations like this, these are times to keep your wits about you and be aware of any type of unusual activity. If you're working in an area with poorly lit parking areas, it's advisable to have someone to walk with you to your car, or make sure that you are parking much closer and not in a position of where you're vulnerable to be attacked. Visible exchange of money. Never be exchanging money in front of other folks. If you need to exchange money, go back into the massage room, close the door where it's just you and your client, and collect the money that way. Excuse me. Deliveries, especially deliveries late at night. If you're receiving deliveries at 8 or 9 o'clock at night, that's one of the circumstances when people will work under the guise of that in order to isolate and attack. Any deliveries, make sure they're left outside the door. Don't let delivery people in. Say, leave it outside the door, thank you. If they're persistent about needing you to open the door, lock the door. Don't let them in. Best advice. In this day and age, Amazon always leaves things outside the door unless you specifically say sign for it. Best just to work that way. If you're working late or early hours, generally late is a bigger issue. Early hours, there are some forms of folk who are attacked at 6 or 7 in the morning. Generally, those folks are usually jogging. It's folks who are out exercising early in the morning. If you're on your way to work, not always is that the case, but as a massage therapist, we can be an easy target, especially if we're carrying a table, which makes us slower and honestly more cumbersome. If you're working late hours, that's under the guise of darkness, there is the possibility of attack just by being out at that hour. Keep your wits about you when you are traveling. Again, if you don't feel safe, call a car service to get you where you need to go, have them meet you at the door. Never put yourself in a position, if you can avoid it, where you are at risk. Now, I'm absolutely one of the first ones to agree with the idea of you shouldn't have to change your life because of a risk of attack. I agree. But these are things that we try and do to maintain our safety, because we are often carrying cash around with us. We're often an easy target because we're healers and we look like we're not going to fight back, perhaps. Consider this part of your training to deal with warning signs. If you are more concerned about the warning signs of possible attack, there are further classes I can recommend that you can take. Please be safe. Please be safe as a massage therapist. This particular threat of attack to massage therapists is it's not necessarily more significant than other jobs. But we do want to make sure that people in our line are safe. Types of sexual harassment you might encounter. There are 2 recognized forms legally. One is quid pro quo. That's where usually someone in a position above you, supervisor, is asking for sexual favors in exchange for benefits. Like, you know, if you go out to dinner with me, I'll make sure you get that different shift. That's called quid pro quo, and it is very illegal. Much more common, however, is the second type, which is hostile work environment. Unwelcome acts such as physical or verbal conduct, or visually inappropriate displays that make the individual's job difficult. This can be unwelcome phrases. This can be generalized statements of sexual natures. This can be inappropriate use of language. This can extend to intentional misuse of pronouns. This can intend to clothing with messages that are disparaging to other people. Hostile work environment covers a lot of different things. These are both still things that happen. Quid pro quo is considerably less now, but hostile work environment is still present and alive in our society today. Unwelcome sexual advances, requests for sexual favors, and other verbal or physical conduct of a sexual nature is considered sexual harassment. When submission to the conduct is made a term or condition of an individual's employment, either implicitly or explicitly, that's quid pro quo. Submission to or rejection of such conduct is used as a basis for the employee's decisions affecting such individual, that's that again. Such conduct has the purpose or effect of unreasonably interfering with an individual's work performance or creating intimidating, offensive, or hostile work environment. That's the second. inappropriate calendars on the walls, archaic language, things that haven't been commonplace in offices possibly for 50 years, but still are. All of these might classify as a type of sexual harassment. Those behaviors are things such as physical contact. Any touch to you that you do not explicitly welcome can be viewed as inappropriate and harassment. Touching, hugging, stroking, any of those things that's not welcome. Inappropriate greetings, language specifically used for you that is not of a respectful nature. Sexually explicit language. Anything descriptive or glaring, certainly. Reference to body parts. You should never be talking about anybody's body except your own. That's pretty safe to say in a negative or positive capacity. You should not be talking about other people's bodies. As a massage therapist, this may seem challenging. However, our statements are usually revolving around our observation of an individual fragment, such as, I observe a red spot on your shoulder. I infer this might be an injury, or it might be a little infected. Am I correct? That kind of language is clinical in nature. That's different from, oh, your shoulders are so large. That's not a statement we should be making. As mentioned before, displaying visually explicit materials is also an extreme no. Here on campus at QCC, if an incident does occur, there might be a need for response on campus or in a department. Your job is to inform someone further up. As you're a student, you might inform faculty, how you doing? You might inform an employee or manager or supervisor. Once we've assessed the situation, if it is life-threatening and immediate, we'll dial 911. If you can't find one of us and you feel it is life-threatening and imminent, you can dial 911. If we feel like this is something that we can correct and it might be able to stave off further issues in the future, we would contact a crisis response team member. Crisis response team will assess the situation and come back to us and ask specific questions about it. There might be a hearing, there might be an intervention, there might be any number of different communications before actions, steps are recommended, and resources are identified. When inappropriate behavior occurs on campus, we work as a team to stave off this action and create correction as quickly as possible. Know that we on the faculty and our managers and supervisors are here to protect you. Very good. There are further resources regarding domestic violence and abuse. One thing to note is that massage therapists are not reporters, are not mandated reporters in New York State. A mandated reporter is someone who is legally required to report cases of abuse where they find them. In some states, like Pennsylvania, massage therapists are, but in New York, we are not, unless we are working for a facility that does mandated reporting, such as a nursing home or a hospital. That said, you might encounter instances where someone might be potentially abused. Patterns of bruises might be observed, or possible repetitive injuries. Cases of abuse are much more common in child population and in the elderly. If you are working with the elderly in a nursing home and you do find what seem to be repetitive cases of abuse, you may report as a mandated reporter to the state. There's a link here about mandated reporting, where if you do need to report, you can report a situation in confidentiality to the state. Generally, adults that come into your office, if you do suspect cases of abuse, you may wish to refer that person to a psychologist. You may wish to refer that person to other professionals. You may refer them to law enforcement, but that's at the discretion of the individual at that point. Standardly, in a mandated reporting situation, we would make a phone call to an anonymous source and the police would intervene. But again, we only do that in circumstances where we are working facilities that demand it. But what is advisable is that you have referrals ready for support groups and appropriate practitioners such as psychologists for people in these circumstances. Very good. There is an assignment I want you to take a look at today, in addition to the homeworks that we've provided for you. In class, we would usually get into a group and read an article that's in your Blackboard right now about pre-sensing. Pre-sensing is a topic that is important to our concept of how we work with people. So that article is located in your Blackboard right now and at your discretion. Please do look over this article. There will be an essay on your midterm exam related to this article. So it's very important that you have it and are able to look at it. Questions you might want to be able to answer after reading this article. In response, explain what pre-sensing is and whether pre-sensing changed the way your physical appearance, or if it did not, explain whether you had any difficulty being able to be present. This is usually in relation to having received a massage or given a massage. As a receiver of massage therapy, what would be some indications that your therapist is being present as they work with you? That's a good question. What are some indications that they are not being present? Being able to understand and indicate when a client is being present is important. Very good. Those are our topics of discussion for this week of September 26th. Your assignments are to look over goal-oriented planning and to have come up with your topic for your paper and presentation for the end of semester. Read the pre-sensing article, finish it up. Prepare for midterm essays. Specifically, we will ask you about pre-sensing. And get ready to write and submit an outline for your research paper. That's due in a couple weeks from now. Very good. If you have any questions related to the lecture I've provided for you today, please reach out to me. Please use the phone number or email on your syllabus, and I will respond accordingly as best I can. Thank you all for listening to this lecture. I hope you have a wonderful week, and I will see you next time. Be well.